A child may present with features that resemble ASD, ADHD, or broad behavioral challenges. But that doesn't mean psychology came first. Often it's a fuel problem. When fuel is limited, executive function is harder to stabilize, and emotional braking systems can fail more easily. So when you see a cluster like this, autism-like features plus seizures, or autism-like features plus movement episodes, especially when symptoms are worse with fasting, treatable energy disorders should be part of the differential. Case 3. How do you diagnose it? How do you connect the scattered clues? First, 2 important reminders. A normal MRI does not rule out GLUT1DS. A normal routine metabolic screen doesn't either. The key often lives in 2 places: CSF glucose and the genetic answer. Step 1. Ask the right questions. Sometimes what triggers it is more valuable than what it looks like. For example, worse with prolonged fasting, worse with skipping meals, worse with exercise, worse with fatigue, worse with fever or illness. And yes, not every patient is that classic. Step 2. Look for evidence of brain hypoglycemia through CSF testing. The point isn't one number. You want the full context. The absolute CSF glucose value, a paired blood glucose, the CSF-to-blood glucose ratio, and age-appropriate reference ranges. A small number of patients may even have ratios that overlap normal, so you can't rely on a single ratio alone. You integrate absolute CSF glucose, CSF lactate, the clinical pattern, and then genetic evidence. Step 3. Confirm with genetics. Sequencing of SLC2A1 detects most cases, but some cases require CNV testing, copy number variant analysis for deletions or duplications, and a negative test does not always fully exclude the diagnosis. The best approach is a loop: clinical pattern, biomarkers, and genetics supporting each other. Case 4. Treatment isn't just suppressing symptoms, it's changing the brain's fuel. One of the core treatments is ketogenic dietary therapy. In simple terms, if glucose can't get in, give the brain a different fuel. That alternative fuel is ketones. Ketones use a different transport route into the brain,